Dr. Caroline kindly take us through the treatment options for throat cancer?
Right, so the treatment options that usually exist will be based more on what you found for this patient. First of all, you'll have to do a CT scan of what we call of the neck, because you actually want to see the affected areas, the surrounding tissues, are they involved, and they're very important structures like the vessels in the neck. We have the thyroid gland, which sometimes you actually want to see, does it look involved, because it can be affected by the treatment or the disease. Some patients have to go to the operating room, not for a surgical procedure, but for the biopsy process, especially if you're having cancer of the voice box or cancer in other parts of the throat where we call the hypopharynx. You will need to take them through chest x-rays, you need to take them through abdominal ultrasound, because one thing before we even come to treatment is we have to stage. So this patient may have spread of disease into the lungs, and that's very important.
So how do you stage throat cancer?
Now, staging is done through a very internationally agreed upon staging system that was actually developed by a joint commission from various countries, which are usually out of abroad. So mostly American and European commissions will sit together and come up with a staging process that will be accepted well over. So for staging, you look at the tumor size, you look at the nodes that we may have.
Someone is asking what staging is.
Yes.
Yeah.
So staging is actually a process where you actually put a patient on either early disease or late disease. And that gives you prognosis in terms of what are the chances of survival for this patient when they go through treatment, and for how many years will you also follow them up before you actually declare them cancer-free. That's the staging process. That's the significance of staging. So you need to do a chest x-ray and abdominal ultrasound to check for either spread of disease to areas that are either near the cancer area that is affected or further than that. And if somebody has spread, it makes the disease more harder to manage, or chances of achieving cure. So staging, you can be told either you're stage 1, 2, 3, or 4. So those are the existing stages. Once we have staged, then you discuss the treatment options for the patient. And I'm glad that Ezekiel is there, because he's mentioned the treatment options for throat cancer that we go through. So we do have radiation therapy, which is basically radiotherapy, where you use x-rays, rays that are x-ray, but these ones are usually targeted to the cancer cells. Okay. Then we have chemotherapy. So these are basically drugs that are targeted at killing the cancerous cells. Why? Because cancerous cells usually are abnormally growing cells, meaning the fact that the size of the tumor goes increasing, there's also a fast rate of growth for these cells. So the disadvantage we have with chemotherapy is that other parts of your body also have a rapid rate of cell replication. Like he has said, he developed sores in the mouth, isn't it? Yeah? Even the skin gets affected. These are areas where our cells divide very rapidly. And so as you being administered chemotherapy, it will affect even areas which have rapid cell replication rate. Then we have also combination of the two. So one patient may go through chemotherapy only, another patient may go through radiation only.
Depending with the staging?
Depending with the staging, the age of the patient, and also the type of cancer that the patient has. Okay? And a patient may go through these two treatment modalities. That is, you can have chemotherapy and radiation, or you can have radiation first, chemotherapy. As you finish your radiation, start on chemotherapy. And surgery also plays a role. He mentioned something important. There's something we call debulking. So the tumor can be large. You want to help the patient, or maybe the patient is for palliative care. So even palliative care is a form of treatment where you can debulk the cancer and continue taking care of the patient. And surgery can be the primary mode of treatment that is done where you actually remove the whole cancer and follow up the patient and leave radiation therapy or chemotherapy later if there's recurrence of the cancer. Yes.
And Ezekiel, how did some of these treatment options or the kinds of treatment that you had to go through affect you generally as they were trying to control the cancer that you, or the tumor that you had? Did it affect you, the chemotherapy, the radiation affect you generally? How did it affect you?
Certainly, I think we are in agreement with the medics that boosting of your immunity is very key in fighting the cancer cells, because it suppresses them and prevents them from rebelling and continuing to multiply, which they do multiply. According to the National Cancer Institute, they multiply in billions. Now, the report I have read is that chemotherapy, while it is killing the cancer cells, subsequently also interfering with other cells, it lowers your immunity. And when your immunity is lowered, you give a chance for the opportunistic disease to come in. I could forget, after a year after treatment, I had to walk on a crutch. Why? Because I struggled with my joints and pain, and when I went to see a doctor, my hands were swollen and they were not even bending. Before even doing a test, she just told me that is arthritis. And when I got a check, even though the report didn't come out as arthritis, but all those were signs. I have since suffered other challenges, maybe not directly, but like I say, they could be as a result of the immunity being compromised, which of course was due to the effect of the chemotherapy, I believe. And I remember when you sit there and you're waiting with people to do chemotherapy, it takes time and you begin to make friends. And you're there for 2 hours. It's a long period. So everybody is telling me my chemotherapies are 6 cycles, but mine were 3. I had to ask the chemotherapist, why are the rest 3? 6 rather,
6, yeah.
and mine are 3? She gave me these words: your case was serious, and we had to administer a double dose. And I understood, no fight. I just said, as far as I was concerned, forget about what people talk about, the dangers of chemo and radio. As far as I was concerned, I was in the process of treatment, and I employed both conventional treatment and nutritional therapy. And that's really helped me. Of course, the most important, the one that helped me most, was the mind. Let me say this. This is very important, Dr. There's a saying, information is power. And when the oncologist told me, the cancer you have is called throat cancer, in a layman's language, immediately I remembered a rumor that there was a leading personality in East Africa who had throat cancer. And I counted the number of years and said, this guy was said to have throat cancer, a very senior leader in the nation. And I said, he's alive? 13 years later, I spoke to myself and I said, I am going to live. And that helped me a lot. In fact, let me finish with this as I describe that. I also remember the doctor telling me, some people have been lucky to go through chemotherapy without being admitted in hospital. I took a look at her and I told her, this man, you will not admit him in hospital. And many other factors that really helped me walk through the journey.
Okay, thank you so much, Ezekiel. Such an inspiring story, and we thank God that you are able to conquer.